Hello everyone, and welcome back to the channel. I'm Dr. Hana Sasaki. If you're watching today because your feet have been keeping you up at night, if every step feels like you're walking on hot coals or thick cotton, or if you've started avoiding your evening walks because the burning and tingling just won't quit, I want you to take a deep breath with me right now. You are in exactly the right place. I see patients like you every single day in my clinic. Wonderful people in their 60s, 70s, and 80s who feel like their bodies are betraying them. Many of you have been told this is just peripheral neuropathy, that it's permanent, that you'll just have to learn to live with it. And I'm here to gently tell you something that changes lives when people finally hear it. While true nerve damage can be permanent, a huge percentage of what we call neuropathy symptoms are actually made worse, sometimes even created by things we can influence every single day. Poor circulation, stiff ankles, collapsed arches, and hours of sitting are stealing your comfort. The beautiful news is that we can fight back right from your favorite chair. In this video, we're going deep. We're going to talk about what's really happening in your feet and legs, bust the myths that are wasting your money and your hope, and then I'm going to guide you through a complete, gentle, seated routine that thousands of my patients have used to feel more alive in their feet again. We'll take our time. I want you to feel like I'm right there with you, speaking to you as a friend who also happens to be a doctor. Before we get started, can I ask a small favor? Take just 5 seconds and drop a comment below telling me where you're watching from and what your feet have been doing lately. Are they burning at night? Do they feel numb when you first stand up? Are you scared of falling? Reading your stories helps me create content that actually meets you where you are. And it reminds all of us that we're not alone in this. Let's begin with the truth about peripheral neuropathy. At its core, it means the nerves that carry messages between your brain, spinal cord, and your feet have been damaged or irritated. Those nerves are like the wiring in your house. When the wires get pinched, inflamed, or starved of blood, the signals get scrambled. That's why one person feels fire under their toes, while another feels like they're walking on sponges. And someone else says their feet feel completely disconnected. Here's where so many people get stuck. The internet is full of flashy videos promising to cure neuropathy in 30 days with one magic supplement. I wish it were that simple. The truth is, once nerves are badly damaged, complete reversal can be very difficult. But here's what I can promise you as your doctor. We can dramatically reduce the irritation, improve the blood flow that keeps nerves healthy, restore better communication between your brain and your feet, and most importantly, help you feel safer and more comfortable in your own body again. I remember a patient named Arthur so clearly. He was 72, a retired postal worker who used to walk miles every day delivering mail. By the time he came to me, he spent most of his time in his recliner, convinced that standing up only made things worse. His feet felt like dead weights. He told me, "Doc, I've had a good life. I guess this is just how it ends." We didn't do surgery. We didn't order expensive treatments. We simply looked at his daily patterns. Arthur was stuck in a vicious cycle. The more he sat, the less blood moved through his lower legs. The less blood that moved, the more swelling pressed on his nerves. The more his nerves were pressed, the more pain and numbness he felt, so he sat even more. Within 3 weeks of doing simple seated movements throughout his day, Arthur was able to stand at his kitchen counter and make breakfast again without holding onto the wall. 6 months later, he was walking to the mailbox every afternoon. Not because we cured destroyed nerves, but because we stopped the things that were making those nerves miserable every single day. So how do you know if what you're feeling is truly nerve damage or something we can influence more easily? Let me give you a few practical ways to think about it. If both of your feet feel equally bad, if the burning or tingling is symmetrical, that often points toward a metabolic or circulation issue that we can support with movement and lifestyle. If one foot is clearly worse than the other, we're usually looking at a mechanical problem, perhaps from an old ankle injury, years of uneven wear, or even how you sit in your favorite chair. Pay attention to timing too. Many of my older patients tell me the burning gets dramatically worse at night. There's a reason for that. During the day, even gentle walking helps your calf muscles pump fluid out of your legs. When you lie down to sleep, that fluid can shift and create pressure around the nerves in your ankles and feet. That pressure creates the 2 a.m. fire that so many of you describe. Understanding this pattern is incredibly empowering because it means our evening routine can make a real difference. Let's talk about your calves for a moment. I call them your second heart. These powerful muscles are designed to squeeze the veins in your legs and push blood back up toward your heart. When you sit for hours at the kitchen table, in the car, or watching television, that pump goes silent. Blood and fluid pool in your feet. Nerves get squeezed. Tissue becomes starved of oxygen. The cycle begins. That's why the very first thing we're going to do together is wake up that calf pump. I want you to get comfortable in your chair, both feet flat on the floor. Now, keep your heels down and lift your toes as high as you comfortably can, like you're pressing them toward your shins. Hold for 1 full second. Now slowly press the balls of your feet down and lift your heels, like you're gently pushing a gas pedal. Let's do 10 of these together. I'll count with you. 1, lifting the toes. 2, pressing through the balls of the feet. 3, nice and slow. Remember, if you have significant numbness, look down at your feet while you do this. That visual feedback helps your brain remember that those feet are still there. You're rebuilding the map in your mind. Feel that gentle burn in your calves. That's good. That means blood is moving. Fresh oxygen is reaching tissues that may have been neglected for years. This simple movement is one of the most powerful things you can do for yourself, and it costs nothing but a few minutes of your time. Now, let's move into ankle mobility. Your ankles are meant to glide smoothly, but years of wearing stiff shoes, old sprains, or simply not moving enough can leave them feeling frozen. When your ankles don't move well, your feet have to compensate, which can stretch or irritate nerves even more. We're going to do ankle circles. If full circles feel awkward or painful, that's okay. I want you to trace the letters of the alphabet with your big toe instead. Start with A, then B. Take your time. Imagine you're painting each letter with your toe. This isn't about perfection. It's about gently reminding your joints and nerves that they're still part of a living, moving system. If you feel a sharp electric shock, that's your signal to stop and simply hold the position where it feels tight. We never push through sharp pain. We work with respect for where your body is today. Tomorrow, it might let you go a little further. That's how real healing happens. While we're here, let's talk safety for a moment. If you have areas of numbness, you must become extra careful with temperature. Never put a heating pad or ice pack directly on numb skin. You might not feel it burning or freezing until damage is done. Always use a towel as a barrier. Check your skin often. These small habits protect the independence you want to keep for years to come. One of the most common complaints I hear is that feet feel clumsy, like they're not really part of you anymore. This happens because the sensory nerves that should be telling your brain exactly where your foot is on the ground have become unreliable. The brain starts ignoring the area, and that use it or lose it principle works both ways. This is where our next tool becomes magical. If you have a tennis ball, a lacrosse ball, or even a frozen water bottle wrapped in a thin kitchen towel, grab it now. We're going to roll it under your foot. Not aggressive pressure, just gentle, curious exploration. Roll from heel to toe, side to side, spending a little more time wherever it feels interesting. You're not just massaging tissue. You're sending a flood of sensory information up to your brain. You're saying, hey, I'm still here. Pay attention to me again. Many patients tell me after a few weeks of this that their feet start to feel more present, more alive. the clumsiness begins to fade. That's your nervous system waking up. If one foot feels much more sensitive than the other, respect that. Do less on the tighter side. Consistency beats intensity every single time. Now let's talk about something that makes a tremendous difference but gets overlooked. What you put on your feet. I cannot tell you how many patients come in wearing shoes that are completely worn out or have zero support. When your arches collapse, they stretch the plantar nerves like overstretched rubber bands. That constant tension creates pain and inflammation. You don't necessarily need custom orthotics that cost hundreds of dollars. Sometimes a good pair of supportive slippers with a firm heel cup and a stable arch is enough to change how you feel by evening. When shopping for shoes, try this test in the store. See if you can twist the shoe like you're wringing out a washcloth. If it twists easily, it won't support your feet. You want something that resists twisting at the arch, but still has enough room in the toe box so your toes can spread naturally. I often recommend shoes with a slight rocker bottom for my older patients. They make the transition from heel to toe smoother and reduce the workload on tired feet. Small changes like this can reduce nerve irritation dramatically. We also have to talk honestly about the lifestyle factors that either help your nerves heal or make everything worse. If you smoke or vape, I need to be direct with you. Every single puff constricts the tiny blood vessels that feed your peripheral nerves. You're literally starving the very tissue you're trying to save. I know quitting is hard. I've walked that road with many patients. But if you want your feet to have the best possible chance, this is the single most powerful change you can make. The same honesty applies to blood sugar. If you have diabetes or even pre-diabetes, those elevated sugar levels directly damage nerve tissue over time. The good news is that even small improvements in your numbers can lead to noticeable changes in how your feet feel. Movement, as we're doing today, actually helps your body use sugar more efficiently. It all works together. Let me add a few more gentle movements to our routine because I want you to have a complete toolkit. After the calf pumps and ankle circles, let's wake up your toes. While seated, try to spread your toes apart as wide as you can, then relax them. Do this 10 times. It might feel impossible at first, especially if you've been wearing tight shoes for decades. That's okay. Even the attempt sends important signals up your legs. Next, we'll do what I call toe yoga. Try to lift just your big toe while keeping the other 4 toes on the ground. Then reverse it. Lift the 4 smaller toes while keeping the big toe down. This might make you laugh the first few times. That's perfect. Laughing while moving is healing too. Now let's integrate some breathing, because stress and shallow breathing make everything tighter. As you lift your toes, breathe in slowly through your nose for 4 counts. As you press through the balls of your feet, breathe out through your mouth for 6 counts. This simple rhythm calms your nervous system while improving circulation. Many of my patients tell me this breathing pattern alone reduces their nighttime burning. Let's add one more movement that helps with balance and confidence. While seated, I want you to slowly slide 1 foot forward until your leg is as straight as comfortable. Flex your ankle so your toes point toward your knee, then slide it back. This gently stretches the entire back line of your leg, where so many nerves travel. Do 5 on each side. Move like you have all the time in the world, because you do. I want to share something very personal with you. My grandmother lived in a small town outside of Osaka before she moved here to be with us. In her later years, she developed terrible foot pain and numbness. Her house had many level changes. Beautiful but dangerous wooden thresholds everywhere. She became terrified of falling. The doctors gave her medication that made her groggy. What actually helped her wasn't a pill. It was the simple ritual she created while sitting on her engawa, her wooden porch, every morning with her tea. She would flex and point her feet, roll a small wooden dowel under them, and talk to her feet in Japanese the way older generations sometimes do. She called it waking the dragons in her feet. That daily practice, done with presence and love, gave her enough confidence to keep walking until she was 91. She could still visit the temple and see her friends. That independence was everything to her. When I see patients your age fighting for the same thing, I think of her, and I know what's possible. This is why I get so passionate about these simple movements. They're not glamorous. They won't go viral on social media, but they work. They give people their lives back in quiet, meaningful ways. Walking to the mailbox without fear, standing in the kitchen to cook for family again, gardening without dreading the next step. These are the moments that make life worth living. Here's how I want you to use everything we've covered today. Start your morning in your chair before you even have coffee. Do 2 full rounds of our routine: calf pumps, ankle circles or alphabet, toe spreads, the breathing version, and finish with the rolling massage. It takes about 12 minutes once you're familiar with it. Throughout your day, set a gentle reminder on your phone. Every 30 to 45 minutes, stand up if you can and do 10 calf pumps. If you can't stand, do them seated. Break the cycle of stagnation that's been hurting you. In the evening, about an hour before bed, do another gentle round, focusing on the rolling and some slow ankle circles. Then elevate your feet above the level of your heart while you watch television or read. Just 15 minutes of elevation can reduce nighttime swelling dramatically and give you a better chance at restful sleep. Be patient with yourself. Some days your feet will cooperate beautifully. Other days they might flare up. When that happens, don't quit. Simply do half the movements with even more gentleness. The rhythm matters more than the intensity. Your nervous system is listening to your consistency. I know many of you will ask about supplements. I've had patients spend hundreds of dollars on special nerve formulas, lion's mane, alpha-lipoic acid, benfotiamine, you name it. Some of these have modest evidence, particularly for diabetic neuropathy, but they are never a replacement for movement and circulation. The foundation must come first. If you want to add something, talk to your doctor about it. But don't expect a pill to fix what daily movement and better habits can influence. A quick word about skincare, because this is so important for older adults and people with neuropathy. Your skin can become very dry when circulation is poor. Dry skin leads to cracks that can become dangerous infections when you can't feel pain normally. Use a simple, fragrance-free moisturizer every night. Something with urea or lactic acid can help remove dead skin safely. And please, look at your feet every single day. Use a mirror if you need to. Check between the toes, the heels, any pressure points. Catching a small red spot early can prevent weeks of trouble later. If, after several weeks of consistent movement and lifestyle changes, you're still having severe pain that disrupts your sleep and your life, it's time to bring in reinforcements. See, a podiatrist or neurologist, they can perform nerve conduction studies that give us a clear picture of what's happening. Sometimes, a specific nerve entrapment is contributing, and a targeted injection or therapy can provide tremendous relief. There is no shame in needing more help. The strongest people I know are those who keep seeking solutions. I want to leave you with this thought. Your feet have carried you through decades of life. They've walked you down the aisle, chased after children and grandchildren, stood in kitchens making meals for people you love, and walked through gardens and beaches and familiar neighborhoods. They deserve your attention now, not with frustration, but with kindness and curiosity. When you look at your feet tonight, I want you to see them differently. They're not broken beyond repair. They're asking for your help. They're asking to be moved, to be cared for, to be reconnected to the beautiful brain that still wants to dance at weddings and walk grandchildren to the park. If this video helped you even a little, please share it with someone you love who might be suffering in silence. So many older adults think this is just how it has to be. You can be the person who shows them there are options. And before you go, Tell me in the comments, which movement are you going to commit to doing every single day this week? Is it the calf pumps, the toe spreads, the evening foot roll? I read every comment I can, and I'm genuinely moved by your courage and your willingness to try. You are so much more capable than you've been led to believe. Your feet can feel better. Your confidence can return. Your life can open up again in ways you might have given up on. Thank you for spending this time with me today. I'm honored to be part of your healing journey. In our next video, we're going to walk through how to make your home safer and more supportive so you can move with confidence and protect your independence for years to come. Until then, be gentle with yourself, move a little every day, and remember that you are still the author of your story. Your feet are listening. Let's give them something beautiful to feel again. Take good care, my friends. I'll see you soon.